Thank you, Marco. And the first thing I'll say is that the company's name is KRY in the Swedish way, because KRY is a terrible name for a healthcare company. And
we
now
can tell
we're
that
live.
it's a great name in Sweden, though, because KRY is a saying for being healthy in Swedish. So it works very well in Sweden, in our home market.
So how many of you have actually called a friend or a family friend or somebody in the family when you had a medical problem and talked to them over the phone, as opposed to visiting? A few hands. Okay, quite a few hands. So essentially, we talked a lot about the last mile, I think, and Johannes will talk about the vision, but the vision is very much enabling caregiving and healthcare at the most basic level, which is really around face-to-face. So KRY is a company that launched 2 years ago, and in a very short amount of time in Sweden, where they started, has taken nearly 4% of the entire primary healthcare market, more than 500,000 patient visitations, and tens of thousands of prescriptions in terms of on a monthly basis. The company also went live in France a few weeks ago, and we'll talk about why we're different, because you've seen a lot of healthcare businesses present. And we went live in the UK just last week.
Yeah,
so it's been a very busy couple of years. On top of all of that, Johannes has raised more than $100 million of funding. So healthcare is something people are talking a lot about. Johannes, tell us why your approach to healthcare caregiving is different, and where does sort of Sweden fit into all of this? Why should we care about Sweden sitting here?
Yeah, no, I can tell a bit about the short story. So we started this out of a patient perspective. I'm a patient myself, and I've seen the pain points in the different healthcare systems, and especially when it comes to access. And we thought we must be a better way of structuring healthcare. And then we started KRY. And yes, as you mentioned, now we serve 3–4% of all primary healthcare in Sweden. And now 5 weeks ago, we launched in France. And yesterday, we launched here with our NHS offering in the UK. And for us, ambition level have always been to make sure that we can be a mass market solution, to be something for everyone. And in order to do so in the Western European markets, you need to address the biggest payers. And the biggest payers, it's not private pay, it's not insurance companies. I guess there's a few insurance companies here, but it's a public system, and we have managed to do so. So both in Sweden, we are a nationwide healthcare provider offering public services, and France as well. So we offer our services to all of the French population, and getting reimbursed by the government. So
what does that mean? Does that mean that I have to pay personally if I'm dialing up to your service in Stockholm? Or is it that the public system pays completely, and it's as if I'm visiting my local GP?
So I think that healthcare models varies a lot between different markets. And I think that one thing that we have been very good at is to sort of maneuver the very complex and political healthcare systems across Europe. And one thing that we know for sure is that we need to go deep into each market and really roll up our sleeves to understand the pain points of each specific market. And models varies between different markets. As in Sweden, we run under a co-pay model, meaning you as a patient, you pay a bit. And in France, it's the same. Here in the UK, you don't have any co-pay models. It's healthcare free, same in Germany. So we act under different models in different markets.
But why have you done that? It's so much easier to just do marketing, acquire a consumer, they'll dial up to your service. We talked about how
people... But you will never be a mass market solution if you do so. If you address the wealthy few, the few that can afford to pay extra for better services or better access, you will not be a mass market solution. And our aim is to be that. Our aim is to be for everyone, not for the few.
And how much do you think is really possible to do via sort of, the telehealth system, if you will, versus physical? I mean, in most of the sectors that we invest in, the online and the offline world are really meeting decisively, where you have to have an offline presence and an online presence. We see this in a lot of sectors. Talk about how this is going to work out in health if you fast forward over the few years. How much can I really do over a phone?
That we almost have been surprised how much things that we can do. And if you look into primary healthcare in Sweden specifically, we can do 50–60% of all consultations that are now taking place in primary care. We can do with the same medical quality and medical outcomes as a physical consultation. And the amount of treatments that we can do just keeps on increasing with new technology and wearables.
I give some examples. So what are the kinds of, is it just about, do I have a sore throat? Do I have a headache? How deep are you going? I mean, you're doing a lot of mental health, for example. We're going deeper and deeper, and for us, it's of course, for mental health, that's one thing that we do. We're running the largest psychology practice in Sweden. We launched it a few weeks ago, and we were 4 weeks in, we were the largest psychology practice. So that we do.
and then we go in deeper and deeper into chronics. The way that I see it is like we always continue to deepen our existing products in the market that we are already in, and then we of course now entering new markets, as with the UK now this week and France in September.
And so when we invested a couple of years ago, I think Norway, we thought this was an interesting model because the environment allowed for it. Sweden was just opening up, but it was all very new. But at that time, the UK, this wasn't really possible, and certainly wasn't possible in France and Germany. As we heard about over the various discussions today, and I think as we all read about, this is definitively going another direction where the governments are realizing, because of the scarcity of human capital, because of the inefficiency on the cost side, because of the waiting times on the consumer side in general, people want to take control of their lives, there's a definitive movement towards the public care system recognizing that. But it's happened very fast.
Yeah.
What happened?
Like we pushed it a lot, of course. Like when we entered the Swedish market, there were no reimbursement structure for our type of healthcare, and then we managed to create, together with policymakers and the government, a nationwide reimbursement structure. And Sweden have a very strong brand name when it comes to healthcare. We're in the forefront of this change, and there's a lot of policymakers and stakeholders within healthcare that are now looking into what we have achieved in Sweden, and it's very interesting to see the whole macro is changing. As Germany was a closed market not a long time ago, and now you have region after region opening up, and we're running pilots there. France now, you have a nationwide system for video consultations with doctors, and the NHS here is also very open for change. So it's a lot of things have happened in a rather short time.
And how do you deal with sort of making sure that you take care of the payers, as you talked about, you take care of the medical community, i.e. the doctors, because that's a big part. You have nearly 500 doctors that are actively working for KRY on either a full-time or a quasi-full-time
or
basis.
Livy, as we
and of
call
course,
here
you're still a consumer
in
business. How do you really balance those constituencies? Do you think of yourself as doctor-centric, patient-centric, really bringing the administration with you?
Yeah,
how do you balance
we used to
it
call
all?
ourselves a tech-driven healthcare provider. Like we are a registered healthcare provider in all markets that we enter, although like we're tech and product at core. I'm a tech and product guy, that's the core of what we're doing, but we're taking a full responsibility of actually employing and training those doctors and clinicians ourselves. In the end, like telemedicine and what we do is not something that you train at in med school, so we take a big responsibility there. And also, like being a digital provider, the tools you can use to make sure that we're always on top of quality. Like we can do, we can measure that in real time.
How do you look at quality? Is it NPS? Is it customer love? How do you define quality as a tech company?
It's a lot of different metrics, of course. Of course, we're looking into the patient satisfaction rates, and we have a very, very happy patients, but also making sure that the doctors prescribe the right type of antibiotics for the right type of sicknesses and so on, and we can measure all of that in real time. And it's a lot of benefits when it comes to keep being on top of quality, being a digital provider, because we actually have all the data and can measure it.
And what do you think the next few years look like in terms of where does healthcare and face-to-face stop? Where does technology and chatbots and AI, how do you think about the balance between technology enabling, but still being focused on caregiving and really a doctor consultation? How does KRY look at the world?
I think it would be a mix of things. Like we don't have any own physical layers, but we have like a big network of laboratories, for example, that we can refer our patients to. We have networks of specialized clinics where we can refer our patients and get the data fed back to us. In the end, it's just about sort of solving the problem for the consumer and making sure that we solve that in a really great way. And we are a consumer product after all. Like our patients is our primary stakeholder, and I'm a patient myself. So what we're always doing is that we ask ourselves, how can we create as much value as possible for the patient? And what has been very exciting about this journey is it's a consumer-driven change. We have been putting KRY and delivery service in hands of consumers and patients, and they said, of course I want to see my GP in this way. And suddenly we now serve 3-4% of all primary healthcare in Sweden, and rapidly are growing into other markets as well. And I think the main thing about making sure that we can be there is that we always optimize for the patients. And then of course we have a lot of clinicians. We also have our payers in terms of government, insurance companies and so on, and making sure that we create good tools and products for them as well. And what always has been very important when entering new markets is doing this together with the public system, as we do here in the UK, doing this together with the NHS and doing this together with the different county councils in Sweden. That has been a very important part of the
a lot to balance. So we have a few seconds left. I'm going to ask you one last question. Why is being Swedish being special? What
It's
about
great
Sweden?
to be Swedish, isn't it?
That
Yeah.
we know, but
Yeah.
what about the healthcare
No, but
system?
I think it's Swedes in general rather open to new technology and trying new things out. And Sweden have been very good at, it's a well-known welfare state, and been very good at like, healthcare, and especially when it comes to quality of healthcare. Then Sweden, as many other markets, struggle with low accessibility, and especially primary care, but that we have now helped solve.
Which is a little known fact. I think we're out of time. Thank you so much, Johannes. Thank you, Marco.